part of the adrenal gland Cushing is? Same, adrenal cortex, glucocorticoid, mineralocorticoid, and androgens. Now what would happen if a patient is with Cushing is they have too much of cortisol, too much of steroids in their body. What would be the problem with the patient would be here. They have high sodium, high sugar, high blood pressure, and what is low here is potassium, and what is low here is calcium. Androgens are affecting the sex hormones. How does Cushing patient look? You all know. Moon face and buffalo hump. The female voice gets more harder and like a manly voice, and they use the word hysteresis. Now, Cushing patient has more sodium, more sugar, more blood pressure, and low potassium, and you have what? Low calcium. They have too much of steroids. Second thing, remember, they're gaining weight. They have high cortisol. Question, patient has Cushing. Reverse isolation. When you are taking more steroids, a patient has a more steroid, the resistance for infection is high. So what do they have here? I will write down is here is the low resistance. Cushing is too much of steroid. What do they have high here? Sodium. What do they have high here? Sugar. What are you going to monitor your Cushing patients are? Number 2, hyperglycemia. You are monitoring their blood sugar. Patient was never been diabetic. Patient started a steroid and patient says, why my sugar is going up? Your answer would be because of your medication, your blood sugar is going high. What is low here? Calcium. 3 is, what do we call when you have low calcium? Osteoporosis, pathological fracture. We already know this patient's steroids are high. This patient is going to be risk for fracture. What would you tell your CNA if you have a patient who's already having high steroid and they're taking high steroids? What do we do here? Turn your patient carefully. Ambulate with assistance. Handle them gentle. Patient is Cushing, patient is taking a steroid. Number 1, they're very risk for fracture, very risk for hyperglycemia. Healing process is very low. How do you remove the tape when you're going? You go towards the suture line. The patient wound is not going to heal. It will take a longer time for healing process. Number 5, prevent a skin care. Maybe a crate mattress, maybe air mattress. Number 6 is bruising, risk for bleeding. You have more steroids and patient has bruising. Why? Because they're risk for. So we are monitoring for any kind of bruising. If you are giving a steroid to your patient, then you got to give with the food. Why? Because it causes GI bleeding. Is number 1, what isolation I said? Reverse isolation. What did we move here after reverse isolation? Hyperglycemia. Bones are very weak. The skin care is important. Special mattress is important. Wound healing process is very low. Patient is risk for getting infection. And skin breakdown, you will monitor for that, giving them this. What kind of clothing do you give them are the loose clothes. So what diet do you think are we going to cut down here? Remember, they have very high sodium. They have very high sugar. You're going to monitor, you're not increasing sodium and you're not increasing more sugar. What is low here? Potassium. What do you do for low potassium? You increase potassium in the diet. Everyone is okay, what do we increase here? Potassium in the diet. They have calcium. You can increase calcium. But remember, you're not doing anything more with the sugar and sodium. Controlling their blood pressure. So you're giving blood pressure medication. Whenever you're giving blood pressure medication, what do you monitor for your patient? Orthostatic hypotension. Everyone is all right? Then what do you monitor? Patient here is very low potassium. You do need to give them the diuretics. Potassium sparing, aldactone. Very good. You have the word no P, no potassium. What is the meaning? Potassium is, when you know P, what does it mean? The kidneys are bad, renal failure. When you pee more, remember simply, we are losing potassium. When we don't pee, we retain more urine. What would be high in the body is the potassium.